Welcome to all my dears. Today we are going to discuss about the second step of cardiovascular examination, that is palpation of cardiovascular system. In cardiovascular palpation, we have to assess the measurement of chest, to assess the shape of the chest, palpate the chest for any tenderness, and on inspection, if there are any abnormal blood vessels, we have to palpate the same blood vessels to detect the direction of blood flow in that particular vessel. Next, we have to check the position of trachea and palpate the chest to assess if there are any presence of thrill in the precordial areas. Next, about the examination of shape of chest. As you know, due to various causes, the chest may get a change in its shape, but in normal personality, the normal shape of the chest is considered as the elliptical chest. To measure the size or the shape of the chest, we can use two cardboards. To measure the anteroposterior and transverse diameter of the chest, you have to put the cardboard first over the anteroposterior direction and put the transverse diameter of the chest with the cardboards and measure the two distances of or two diameter of the chest, that is anteroposterior and transverse direction. And on measuring, usually the transverse diameter is greater than the anteroposterior diameter. If so, that type of shape of the chest is known as elliptical one. And check if there are any precordial depression or bulging. The same had already discussed in chapter of inspection of cardiovascular system. Next, we have to palpate the chest if there are any tenderness or not. Regarding the position of patient, it is always better to be in lying or supine position, and head end of the patient should be at 45-degree angles. As far as possible, palpate the whole of the chest very gently, especially over any swelling or costochondral junctions. Simultaneously, while palpating the areas of chest, just look over the face of your patient, because if there are any tenderness, that will be usually expressed in face of your patient. So from the facial expression itself, without asking any question, you can understand whether your patient is having any tenderness in chest. Usually the tenderness of the chest may be seen in cases of various causes of myalgia or any fracture in the chest or condition like costochondritis, or in cardiac conditions like acute pericarditis, or in conditions like congestive cardiac failure, or even in patient with myocardial infarction or angina pectoris, or any other local inflammatory condition can also give tenderness in the chest while palpating the same. Next, we have to palpate to study the direction of flow in vessels. That means if our patient is having any abnormal veins or abnormal vessels over the chest, we have to palpate the direction of flow. As mentioned earlier, position is supine one and head end should be at a 45-degree angle. Put your two finger, especially the index finger and middle finger. By using the fingers, you have to squeeze the vein to empty the veins. And after emptying, then release the upper finger or lower finger alternately to note the direction of filling. If the filling of the vessel is from above downwards, possibly that indicates superior vena cava obstruction. If it is from below upwards, usually that is due to inferior vena cava obstruction. Next, we have to palpate to assess the position of trachea. Regarding the position of your patient, ask your patient to sit in a bed. That means sitting position is a better position. Then put your index and ring finger over sternoclavicular joint on both sides and trace the trachea with your middle finger. And after that, insert the middle finger in space between sternocleidomastoid muscle and the trachea on both sides and check the distance between the index finger and ring finger. By that way, you can assess the position of trachea. If there is no deviation, the distance between the two sides, that means from the right and left side of the trachea, may seems to be very normal or equal, or if there are any huge bulging or deviation, that will give some changes in the space between the right and left side of the sternum of your patient. Usually the position of trachea may get deviated, especially in pulling pathology like collapse of lung or pulmonary fibrosis. And at the same time, due to some pushing pathology like pneumothorax, pyothorax and pleural effusion, the trachea may get deviated.